Good afternoon. My name is Ray Lucio. Today I will be talking about the importance your pharmacist plays in public health. So, more often than not, patients are afraid to talk to their pharmacist. Um, Especially down here in South Texas. I don't know if it's just cultural influences or stigmas, but it's definitely a major issue. Most of the patients here just blindly trust their doctors. Um, Instead of going over to their pharmacist and going over their medications, the side effects, their regimens, basically every detail, where as to other states, your pharmacist and your doctor work hand in hand. In other states, your pharmacist can actually prescribe medications with the doctor's intent or approval, which is great. Here in Texas, they're not allowed to. But we do still play a key role. For example, which with my experience in retail pharmacy does happen quite often. You have one patient who will go into the pharmacy and say this patient sees 3 different doctors. They'll come into the pharmacy one day, get one medication for high blood pressure. The next day they saw a different doctor and they have another different medication for high blood pressure or for swelling or water retention. And this certain patient could be on a regimen of taking maybe 10 pills a day altogether between different kinds of medications. A pharmacist's duty in public health is to actually take the patient aside and counsel them. Make sure they understand what they're taking. Several doctors prescribe medications that are for the same exact thing. It could be whether it's blood pressure, diabetes, you name it. There's multiple medications out there for it. There's also medications that are combination medications, combination drugs, which can have multiple medications in one pill. So for example, say that one patient is taking 3 medications for hypertension. They can go ahead and a pharmacist can find an equivalent medication to just take one pill. Instead of taking 10 pills a day, now they're taking maybe 7 pills a day. Definitely helps the patient, eases them, knocks some worry off of them. A lot of the elderly patients do forget to take their medication. This is also where pharmacists come in. Several patients don't know the side effects of their medication. Again, they blindly trust their doctor without knowing truly what they're putting into their bodies. There are some medications that have horrendous side effects, but because the doctor is pushing the newest drug out there on the market, they go ahead and take it. A pharmacist can truly, or should truly, take into consideration their patient and the patient's health by going over every single possibility of side effects or reactions that this medication can cause, as well as any contraindications with other medications the patients are taking. I can give you an example of something that can happen on a just regular day in a pharmacy. I have 2 different medications, 2 of the same medication. They're just different forms. So in one bottle, I do have this medication, which is a anti-inflammatory. It's usually used, could be used in sports injuries, patients with arthritis. It has a variety of uses. At the same time, we have the same medication in a gel form. So, more often than not, doctors can give their patients the same medication. Now, they are not supposed to be used together. It is the same medication. If you do use them at the same time, you are over-medicating yourself, which is not something a doctor explains to them. They just say, we're going to give you a new cream, you're going to try it out. Sometimes they don't even explain how you're supposed to use the cream. Certain creams like this and several others have to be measured out specifically. They come with specific instructions. Usually the doctor should go over that. Again, this is the pharmacist's key role in making sure the patient understands this medication, when used incorrectly, can harm you. So we have to go over exactly how you're going to use it. It does come with a little measuring guide, and we walk the patient through it hand in hand, make sure they understand. Now, as I said, this is a very important topic because this is something we need to see more of. Patients shouldn't be afraid to ask their pharmacists. Pharmacists are there to help. We're here to explain to you, make sure you're comfortable in what you're taking. Because without us or our knowledge of the medications and our knowledge of your history, we can't make you comfortable. We can't assure you of you're getting better or you recovering from something. But if a pharmacist goes and just takes you, makes you feel comfortable, reassures you, and gives you the knowledge, the power to know exactly what you're taking into your body, that should give you a great peace of mind and also help you know, or help you rest assured that you have the right tools or the right medications that you need to get better. Thank you.